Hi, my name is Tim Hodges. I'm the founder of the Fascial Counterstrain Academy. It's been around for about 10 years now, and over the last 5 years it's been a much more formal operation. I used to take one or two people around, for about a year, help them out, make sure their palpation was where it should be, make sure that if they were having trouble with certain releases that we could actually get them to refine their technique to the point where they could reproduce the same results over and over again, and then answer questions with complicated patients. And that was working fine when I only just had one, maybe two people who were interested. But over the last few years, 3 or 4 years, the increase in demand, the number of people that have contacted me independently and asked to join this growing movement has taken the small, one or two person operation and grown it into something that is not only run now here in my office, but in multiple locations throughout the country. So the opportunities are growing. The opportunities for you guys to participate in something like this has never been better. So we actually have the ability now to take this program on the road, which we will be doing this fall in several different locations. We'll show up at your location for one, maybe 2 days in a row, but we'll do it every other week so that it's a constant reinforcement of these techniques and concepts that we have now all come to know as fascial counterstrain. And I think the biggest question people have is like, what am I going to get out of something that you charge 2 or 3 times what the Jones Institute charges, but technically it's still the same information. And the best answer for all of you is to realize that the process of learning something like counterstrain, we all get similar ideas, I think, when we sit in a class and we listen to Brian or myself or Randy or Dr. Gehring teach. But when we leave that environment, we go back, what we're left with is the book that we were given, the notes that we took, and anything that we can remember about the weekend. And if it was as simple as taking all of that information and sitting with it and applying it in a clinic, then we wouldn't have any questions about how to perform this technique. But every time I'm at a class, there are hundreds of questions. And questions can be, simple, like, well, what surface are you palpating? Or they can be a little more complicated, like, what exact tissue are you treating, and how do you contact that? How do you apply your treatment to that structure, which is, quite deep in the body? To much more complicated, which would be, I've got this chronic failed case, and I'm having trouble. I can't seem to get anything to go. Can't get treatments to stick. The problem, is persistent. All the normal diagnostic things have been done. There's nothing that is showing up medically, so it seems like this is the right thing, for this patient. But I'm stuck. I can't get past, a certain level of help with this patient. And then, the questions that we all have about sequencing, or how does the cranial scan work, and what should I be feeling when I'm using the cranial scan? Things like that generally will take you months to gain the same level, or at least close level of understanding that someone like Brian has. So you can't do something like that in a 3-day period of time. You need a much longer experience. So this internship program grew to this mastery program, but it still has the same concept, which is a spaced repetition format, which is one component. You have about 3 different components that you need to have incorporated in any kind of learning environment in order for you to master the material. You certainly can't do it by just immersing yourself for a few days. You need to get this spaced repetition component done. That's what the internship, or this master program, as we now call it, that's what it provides. It provides an opportunity for you to repeat this thing that you learned over a 3-day period of time over a 10-week period of time, where you have twice the contact in terms of hours, but the amount of time in between allows you to sit with some of the material, to digest it, to go back to your own clinic, use it, come back. Hey, I still have a problem with this one. I can't seem to get, where's my error? What have I done wrong here? And then you do this again, week after week after week. So these are done in a way that allows you to take the information, use it, see where you've gone wrong with it, or see where you have troubles with it, come back, get your questions answered, refining the technique constantly. So there's this always in the back of your mind, you're always improving. Every single time you come back, there's going to be one small thing that you didn't quite get. And our job as mentors is to take whatever level you're at, because there are people that come in that are extremely advanced and people that have just started. Take whatever level you are at and improve it. And once you've gotten this spaced repetition component added to your mix, you're going to see a lot of things improve. You're going to see your competence with the techniques improve. You're going to see your questions begin to slow down or go away completely in terms of how do you produce an accurate result. You're going to see your confidence in implementing the techniques go up. So you're going to have many different ways of improving your technique, and then ultimately you get the opportunity to model the behavior of an instructor. If we were all given the opportunity to go hang out in Brian's clinic, or if you wanted to come hang out in my clinic, it would be, that might be the ideal at a high level. Once you've attained mastery in multiple systems, the final question that a lot of us have is the clinical application. What does the clinical application look like? We talk about it briefly, but there's often so much information that we have to cover in these courses that it's the last thing on the list, and it usually gets thrown in during our wind down lecture. But that's like the most crucial component. How do you apply this clinically? Do you have a systematic approach? Is it a little bit in every system? Is it worst system in the head first, and only that? Do you apply it locally, to acute patients? Do you have a different methodology if you're applying this to a chronic patient versus, acute or subacute or post-surgical, or failed case, or what have you? Or what about if you're dealing with somebody that's got chronic infection? Ultimately, these are all questions that deal with how we use it in the clinic, and they're not things that we typically cover in our 3-day seminar. Number one, the importance of understanding why the technique works. That's paramount. We have to do that in those 3-day seminars, and then we have to introduce you to number two. We have to introduce you to all the different techniques. You have to understand, how do you palpate for this? How do you produce the desired result with your contact, with your fascial glide, your compression techniques? So at the end of the day, we're left with very little time to go over clinical application. That one component is through every single module of the internship program. We cover that in depth. We do patient treatment scenarios. We do student clinics. This is where you will bring in a problem child, hopefully not a really, really difficult one, because your peers are going to be working on these patients as well. And we run student clinics for like 4 or 5 weeks, usually in Module 2 and Module 3. And all it is a coached clinical application. So we make sure that there is, not too many students per instructor, so that you're not completely overwhelmed with trying to solve the problem on your own. You're going to have somebody right there with you, doing the cranial scan with you, putting your hands on the cranial scan, showing you exactly where you're having an impact or where you should be feeling a restriction, what system. And we do this, a week in and week out, so that not only do you get a revisit of these techniques, tender points, palpation technique, the cranial scan component, which is a hugely important, integral component of what we do, but this coached clinical application. And then as we get into more advanced levels, we do look at systemic treatments. What do you do if you do have somebody that's got a chronic infection and their entire lymphatic system is completely stuck? Is there a way to unlock that in one session? Is there a way to get their immune system boosted and allow their body to function in the way it should and attack this chronic infection and do it quickly? So that's kind of the main goal of this internship training program, or this mastery training program, and that is to improve the clinical application, which ultimately produces a much more confident, competent and quality practitioner, which is what we're after, right? I think if we look at the business model that we've used for many years, it's been, let's fill these classes, let's get as many people in, exposed to the technique as possible, and there's merit in that. Absolutely, you've got to expand the amount of people that know what exactly we do with counterstrain in order for there to be more available throughout the entire country or the world access to this technique. At the end of the day, though, if we want to have a huge, not just life-changing for our patients, but maybe field, or if you look at the entire healthcare field, I do believe that what we do now with this technique has the potential to create large change in this field. Not the least of which is helping everyone understand, what is the difference between a true medical problem and a dysfunction, and then everything in between, and how trying to figure out some of these really complicated failed cases requires us to be able to ascertain very quickly, does this person belong in my office? And our cranial scan certainly allows us to have a portion of it. We can see, does this person have the dysfunction that they need for me to say, yes, you are my patient? That's the easy part. The harder part is also navigating all the other layers that create their problem. And so I do believe that the understanding that has come along with the development of fascial counterstrain will at some point translate into a very, very large global impact in the field of healthcare and medicine. So I'm extremely excited, and I want you guys to be able to know a little bit more about what a prospective student can expect, and then ultimately, of course, everyone wants to know what's the result, what's the end result, and so don't take my word for it. I'd like you to stick around for a few more minutes, not listen to me ramble, but listen to some of the students that have come through the program, tell you from their own perspective, what they got out of it, what they found beneficial, and then ultimately their suggestions to those of you who are watching. If you're really, really committed to this process, and I'm not looking for everybody. I'm not looking for everybody that comes to a Jones course. That's not my goal. My goal is to get the people that want to master this. You've got to have that passion in you. I can't put it in you. Randy can't put it in you. Brian can't put it in you. It's got to be in you already. You got to have that passion. I want to take that practitioner, the passionate, committed practitioner, who wants nothing more than to master this technique, feel confident with it, and then be able to go out and use it on their patients with success and be rewarded by helping them. That's the practitioner I'm after. So if that's you, I want you to sit around here, watch this a little bit, and then contact me and let me know when you want to start. Thanks.
I'm a physical therapist from Olympia, Washington, taking part in the Fascial Counterstrain Academy, just completing it, the intro portion of it, and been asked to give a couple words about my experience. I would say one of the things that I've noticed primarily is that my competency with the head scan has improved dramatically, to the point where when I started this program I had very little confidence that I could scan the head and go treat the body appropriately, and now I feel with some regularity and pretty good consistency I can get information from the head that tells me what to treat in the body and what sequence to treat things in the body, and as a result the results I've had with patients is dramatically improved.
What do you do?
Hi, my name is Keith Kjellma, family practice osteopathic physician. Been in Portland for a number of years, 26 years to be exact, and been involved with counterstrain over the last 15 years, and discovered fascial counterstrain through the Jones Institute, and participated in all classes in regards to the fascial counterstrain model, and then I participated in the Fascial Counterstrain Academy's courses with Tim Hodges and Chris Michaels, instructors that we have currently. Have been impressed and also have had incredible results with patients that the regular Jones, conventional regular Jones model was, although helpful, not complete. And since being involved with this coursework. The expansion of the tender points from 180 to now 500 or 600 has been immensely helpful in aiding me in regards to helping patients with all different sorts of complaints, not only musculoskeletal, but lymphatic, venous, visceral, neural, arterial, and arterial issues they may have. So it's been a real eye-opener for me in regards to treatment, and I recommend these courses highly. To me, this is the penultimate in regards to osteopathic treatment for helping and aiding patients using the osteopathic model. The founder, Larry Jones, was an ingenious man, and we've basically followed in his footsteps and created a model that has been absolutely extraordinary. And the Fascial Chemistry Academy offering these classes has been very helpful in regards to for my patients, for my learning, and for my ability to help those people in healing themselves.
So my name is Mandy Schwindeman. I am a licensed acupuncturist in Oregon, and I am in my second year of counterstrain training. This is my first internship class that I've taken, and I have to say that I did get a tremendous amount out of the class that wasn't offered in the short weekend sessions to emphasize what I learned there. I appreciated the cranial scans and the ability to repeat them and have multiple different heads to work on them. And I appreciated the recurrent aspect of it, as I'd have an opportunity to go away for a week and then come back in and look what my questions were, look what I felt uncomfortable with and insecure about, and be able to ask that or demonstrate what I had been doing and find out, was I doing something wrong, or was I treating the opposite thing that I thought I was? And that really has opened the doors for me to using this in my practice for a much more efficient and effective manner. So I definitely recommend taking it, and I will be taking a future class because it's definitely worth finances to invest in my further education.
I've been working as a physical therapist since 1997, and I first started taking counterstrain courses in 2001, and it's been probably the main method of manual therapy that I've used. I've actually become certified in the technique through the Jones Institute in 2004, and have been using counterstrain as a full body modality manual therapy form for quite some years now. The new fascial techniques have been pretty amazing, kind of taking counterstrain to the next level. And this course through the Fascial Counterstrain Academy, the Mastery Program, has just really taken me to a higher level in the sense of being able to use the head scan much more effectively. Anyway, what I've taken back with me to the clinic from this course has just been amazing in the short time that I've been just doing the introductory course. Really, it just seems like my skills have improved a lot. I've been able to treat dysfunctions and areas that I had treated before, but with more, being able to be more effective with the treatment. And I'm just really excited to learn more. I'm looking forward to the next course, which I'm already signed up for, and I'm just amazed about this technique, and it's kind of fun to be in it's still being developed, and so we're learning new things, and some things are still changing as we're learning them, and it's just a really fascinating, kind of amazing place to be, and it's I just think it's amazing to be part of this. Well, we had a very small class, which I thought was wonderful, because you do get a lot of very personal, hands-on feedback, mentorship by the instructor and the assistant instructor, which has been wonderful because it really allows you to not only ask questions, but also to get your technique and how you're doing things. You get feedback on them. I don't want to say critique, because we all need to learn. And as we're learning, we don't always do things right the first time, or it's a little bit of a learning curve. And the small class sizes have been wonderful, because you get a lot of that personal attention from the instructor.